Hi, my name is Rick Olderman. I'm a physical therapist and Hanna Somatics practitioner, and we're going to talk about chronic knee pain. So what are we talking about here? We're talking about things called anterior knee pain syndrome or osteoarthritis, patellar tracking problems, and so forth. So whatever the name is of the diagnosis that you have, this program will probably help you, and that's what we're going to be talking about today. It's important to understand that the knee is caught between two giants, and those two giants are the hip and the foot. There's relatively little in the knee that's controlling the knee. Everything that's controlling the femur here is usually originating from the hip, and everything that's controlling the tibia down here is usually happening from the foot. So the knee is basically caught between these two guys. Let's look up at the hip. So one of the muscles is the butt muscle, the gluteus maximus. And you can see it has a lot of different functions. It controls rotation of the femur, extension of the thigh bone, and then here's the gluteus medius. It controls external rotation. And the gluteus medius is balanced with the tensor fasciae lata, and that can help control external or internal rotation of the leg. So there's lots of stuff going on here. The hip has huge influence over what's happening at the knee because, let's face it, the thigh bone is half of the knee joint. Now, if we look below, we look at the calf muscles and the soleus and the plantaris muscles, and a lot of these insert above the knee joint, so they have a lot to do with what's going on here at the knee. So we have to understand what's happening at the foot and how it might be influencing the knee joint too. And of course we have walking mechanics, so how we walk and turn on or off these muscles makes a huge difference as to the types of stresses we're placing on our knees. And then of course we have to understand whether we have an anteverted or retroverted femur. Now those are just fancy words to say whether your thigh bone is actually rotated in or rotated out. And there's actually a test for that, and I'll show you how to do that and figure that out for yourself. I have solved so many knee problems just by understanding that little tidbit and changing how people are standing and walking. It's just amazing. So don't skip that test. And then of course, going back to the foot, if the foot is pronating, then it's going to drop the knee in more, which then of course drops the pelvis down too. So there's a lot of systemic issues going on here, and so we have to think of the body more systematically rather than just knee pain. I have to look right here at the knee. No, I have to look at the foot and I have to look at the hip as well to solve what's happening here. There is one muscle in the knee that actually controls the knee, and it is called the popliteus muscle. And here's the inside of the knee, here's the outside of the knee. So the muscle, and we're looking at the back of the knee right now. So the muscle runs from the inside of the knee towards the outside of the knee. And this is my secret weapon for chronic knee pain. I don't care whether you have arthritis or anterior knee pain or lateral tracking problems with the kneecap. If you do the popliteus release that I have shown in the videos here, this will get rid of a lot, if not all, of your knee pain. Now, it may come back because you haven't fixed the other functional issues that are causing this muscle to be stressed, but if you want immediate relief, go to the popliteus release and do that, and you'll feel so much better for doing that. I have, there's one that you can do yourself, and then I have one in the practitioner help. Well, where do I go from here? Well, you can go to fixingyou.com and visit the top tests and tips and get started on understanding and fixing your pain. You can also go to fixingyou.com and join the interactive online clinic and finally solve all of these systemic issues that are creating your pain. Regardless, I want to thank you for watching this video, and I hope to see you at the Fixing You Interactive Online Clinic. Thanks.